Welcome back to Aging Untold. We often talk about wills and power of attorney, but there's a human side to planning that those legal documents just don't cover. Sam, what is a care manual and how can this reduce family stress and conflict?
Oh my goodness, this is like, for me, one of the most important things we could ever talk about. I have worked as a caregiver many, many times, and not knowing how to make somebody's coffee or not knowing how they like their food done, or when you put someone to bed or you assist someone into the bed, do they want to be covered? Do they want a fan on? Do they want music? Do they want it dark? All of those things. And I teach this, I tell this, I've written a book about it. Just because you can't communicate what your preferences are doesn't mean they don't matter. And so we failed to do that. I realized one time as I was leaving home and I wrote out this great big long list on how to take care of my dogs. And I'm like, oh my gosh, I'm telling somebody how to take care of my dogs. How do you take care of me? And we failed to do that. I know every one of us at this table has an idiosyncrasy. We have some kind of a preference, and everybody out there does. And if we're not telling somebody, how do we expect them to know it, and how do we expect them to do it right?
Yeah.
Well, I have a lot of idiosyncrasies, so I'm going to start to get to work on this right away.
You need to.
I will.
Yeah.
But I think you really dive into the details of it, because I love that you're talking about this. Like, do you like socks on when you're in the bed?
Yeah.
How do you like your coffee? What time do you like your coffee? What makes you poop?
Yes.
You know, how many blankets do you like? And then the other thing I thought about was trust. Like, what would breach trust? Some people are huggers, some are not. Are you respecting the distance? How close are you? Are you looking them in the eye? Like, think about, because the biggest thing is trust when you're receiving care. Do I trust you? And are you doing something that would breach that trust when I can't tell you what I like?
And that's the other thing. You don't know what you don't know. You know, and you can't expect anybody else to have ESP. But if you think about it by voicing that and verbalizing it in advance, that's really genius. I would have never thought of that. I would have thought about the wheels and all that.
Right.
But in addition to that, the actions that you do to that person can actually be exacerbating their symptoms.
Yeah.
So you may be making that dementia and all that even worse because you're offending them and you don't know it.
Good point.
Just, you might be really aggravating them and have
Right.
no idea.
Yeah,
like,
right.
I wish these socks weren't on my feet. That could drive you crazy if you don't want socks.
Right. Can you imagine having had maybe a stroke and you're non-communicative, you're not able to share, and somebody washes your bed sheets in a detergent maybe you're allergic to, or you can't stand the smell, and you can't tell them? How maddening is that for you? And then all you hear from the family member or the caregiver is, well, they're combative, they're unhappy, they're unsettled. Okay, what are we doing and how can we do it? The only person that can communicate this is you. Don't expect your family to know. I have one person in my life that knows how to make my coffee, and it's my granddaughter that lives in Kentucky. I mean, just, you know.
Videotape.
Yeah, so you have to write these things down, and then you have to know that your preferences will change as you get older. Write them down again, revisit them, but make sure you're leaving that behind, because the best thing you can do for them and the best sign of love you can give them is to give them your care plan.
So clarity now is a kindness later.
Yes.
Perfect.
All right. More to come on Aging Untold.